The Amsler Grid is a simple yet powerful tool for evaluating the central visual field and detecting macular disorders such as age-related macular degeneration. The Amsler Grid allows clinicians and patients to monitor the central 10 degrees of vision, helping detect subtle changes in the macula before they become symptomatic. The patient fixates on the central dot while observing the grid lines. Any areas where lines appear wavy, blurred, or missing may indicate macular pathology. Distortions in the grid, such as wavy lines or metamorphopsia or missing patches, scotomas, may indicate macular edema, degeneration, or other retinal pathology. Patients may also notice objects appearing smaller or larger than normal. Amsler Grid testing is particularly valuable for early detection and follow-up of macular disorders such as age-related macular degeneration, macular edema, and central serous chorioretinopathy. Testing should be done monoocularly at about 30 centimeters. High-risk patients are encouraged to perform daily home tests and report any new distortions promptly. The Amsler Grid is not a single chart. In total, there are 7 different types of Amsler charts, each designed to detect a specific macular abnormality. These include the standard grid, grids with diagonals, red on black charts, random dot charts, horizontal line charts, fine line grid, and high sensitivity central grids. Understanding the purpose of each chart improves detection of subtle macular disease. To remember the 7 types of Amsler charts, use the mnemonic. Some doctors really do have fine clinic. Each letter of the word corresponds to one modification of the Amsler Grid. The standard Amsler Grid has a black background with white grid and a central fixation dot. In a normal response, the patient fixates on the central dot and reports that all lines are straight and continuous with no missing areas. The modified Amsler Grid has a white background with black grid and a central fixation dot. Despite the change in background and grid color, the perception remains uniform, indicating normal macular function. Chart 2 contains diagonal lines intersecting at the center. These diagonals help patients maintain fixation, especially in the presence of a central scotoma. Chart 3 is a red on black Amsler Grid. It stimulates long wavelength foveal cones and is useful for detecting subtle color scotomata commonly seen in toxic maculopathy, optic neuropathy, and chiasmal lesions. Chart 4 consists only of random dots and has no definite pattern. This chart helps differentiate a true scotoma from metamorphopsia because distortion cannot occur without a form. Chart 5 contains only horizontal lines. It is designed to detect metamorphopsia along specific meridians and is particularly helpful in patients with reading difficulty. Chart 6 uses finer lines and allows a more detailed evaluation of macular function. Chart 7 has an additional fine central grid, with each square subtending half a degree, making it more sensitive for detecting subtle central field defects. In summary, the Amsler Grid is a simple yet effective tool for detecting and monitoring macular disease, enabling early intervention and better patient outcomes.